Joining us now with some more insight, former acting director of the CDC and president and CEO of the Robert Wood Johnson Foundation, Dr. Richard Besser. Dr. Besser, always good to have you on with us. Dr. Besser, I want to start with where Dr. Fauci just left off, this idea of herd immunity. Should we eliminate that from the lexicon now? Should we stop talking about this idea of reaching herd immunity in this country and instead just focus on getting the most shots and the number of arms as we can?
The simple answer to that is yes. I don't find the conversation around herd immunity to be very, very helpful because it's clear from data in other countries as well as what we know about infectious diseases is the more people who get vaccinated, the less transmission there's going to be in communities. And the idea that we're going to be able to get every community to that 80% or whatever the threshold needs to be level so that there's no more community transmission, especially at a time when there's no vaccines for children, doesn't really help. It kind of takes away that the value people may see in themselves getting that dose. If you can't reach herd immunity, is there any reason? Well, there is. Every person who gets vaccinated will help reduce transmission in this country.
You mentioned children. We've learned the FDA is preparing to provide emergency use authorization for the Pfizer vaccine in children 12 to 15 as early as next week. You're a pediatrician. What do you think that rollout will look like once approved?
Well, I want to see the FDA analysis of that. All we've heard so far is the release from the company. But assuming they determine it's safe and it's effective, the advisory committee to CDC will then make recommendations whether all children 12 and older should get it, how it should be given. Hopefully, they're going to use children's doctors' offices, places where there's a high level of trust to get it out there. Pediatricians, family doctors. But I'm really excited because adolescents are part of the transmission chain. They are at lower risk than adults for severe disease. But if we can get our middle schoolers, our high schoolers vaccinated by this fall, that would be huge. That would be major weight off parents' minds, knowing their children are protected, yes. As well as value to teachers and staff who are in the schools doing their jobs.
And then there's the next age group, the 2 to 11-year-olds. Maybe by September, Pfizer could see clearance for those aged children. So do you think we're going to get to a point where getting the vaccine will be mandatory for them to go to school? I know I have to have proof of a flu vaccine before my son can go to school.
Yeah, we'll have to see on that. I think it's going to depend somewhat on what happens to the ongoing transmission in the country. There's just been great news on that front in terms of most states seeing big declines. We're going to have to see what happens in terms of the mutations in the virus, whether there's still significant transmission and concern about variants. And then it's important for viewers to recognize that the requirements for school vaccination are done on a state-by-state basis. The CDC makes recommendations on that from their advisory committee. But each state will determine that for themselves, whether they think it's something that should be required.
Dr. Besser, I want to get your take on something while we have you here, because as you know, the White House confirming on Tuesday that some governors are now going to be able to actually turn down vaccine doses if their state doesn't need them, allowing the unordered supply to be allocated to other states. What do you make of that decision?
I think it's the right decision, and what the White House is doing, they're continuing to allocate by population. But if there are states where the vaccine isn't being used, let's get it to places where there is that demand. And I hope it goes further than that. If we've got supplies of vaccine in this country that we're not using, there are so many countries around the world that need vaccine that haven't been able to vaccinate healthcare workers or elderly people who are at much greater risk than very young people. It would be, I think, shameful for vaccine to be sitting in warehouses that could be saving lives.
Countries like India specifically come to mind. Dr. Richard Besser. Dr. Besser, always good to have your insight, sir. Thank you.
Thank you very much.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.